Right now here at 4, we're going to spend a few moments talking about our mental health. That's because May is Mental Health Awareness Month, and it's certainly a topic that impacts all of us and many people around us. In recent years, we've seen a push to increase the visibility of mental health, but still so many struggle in silence. That's a key point. And Kelly Gillooly with U of L's Peace Hospital is joining us now to talk about such an important topic here, the mental health in May. We are emphasizing that. Let's talk about the pandemic. We're hearing more and more about mental health. We're seeing incidents, violent incidents across the country and our community. Many of them tied to mental health.
Yeah, we don't want to necessarily assume that the person that, I think you're referring to some of the active shooter situations. We don't always want to assume that they had a mental health diagnosis. But to your point, absolutely. People in the last 2 to 2.5 years have been isolated. We've seen an increase in anxiety, depression, substance use. So we definitely are concerned about that, and we want to make sure that we're raising awareness and teaching and sharing information how people can get help.
So Kelly, why do we often overlook our mental health and it can get to the point where you're in a crisis stage?
Yeah, I think a lot of people don't want to, oh, it's just I feel anxious today, I don't want to be overly sensitive about it. I don't want to jump to conclusions that it could be something more significant, but we really need to pay attention to those small, subtle signs and symptoms in ourselves, but also in our loved ones, because we want to be preventative and catch symptoms and signs early so that we can get the help and treatment that we need.
So if you need to turn to a mental health professional, how easy is it finding somebody now? The demand is just overwhelming.
Yeah. It's difficult. Definitely if you're in a crisis situation, you can always call 998, the National Crisis Line, and get help immediately. There are hospitals in our community, U of L Health. We offer Peace Hospital assessments in all of our U of L Health emergency departments for someone in crisis, or they can come to our main hospital on Newburgh Road. But yes, there are limited therapists. We know we need more mental health professionals to help our community members, and so it's definitely an issue for sure.
Give me some of the signs. When is it time to see a mental health professional?
You want to pay attention to things that are interfering with your life, those changes, things, if you're looking at a loved one, something that's out of character that you haven't seen before, increase in sleeping or lack of sleep, appetites affected, they're maybe tardy to school, they're not showing up for work, just behaviors that are out of character for that person. You want to pay attention to those and actually have an honest conversation, not ignore it. Ask them if they're willing to talk about it, and are they willing to seek help? Willing is the key word, isn't it? That's true, yeah. They have to be willing, but I think if you're open and very non-judgmental, you approach the person that I just want to help you. I'm not here to judge you. Destigmatize and say, I want to help you, and let's go together. All right. Kelly, thank you so much coming in from U of L Health today. Thank you for having me. Thank you.